we're here in beautiful Johannesburg, South Africa. We're here as part of a bit of a trip to help tell an amazing story about some early childhood development work that's being done here. And we're here with Dr. Marc Aguirre, who's the country director for South Africa. Just an amazing sort of story, and thanks for, I guess it's been great to be able to hang out, have a little braai, and get a little South African. We learned a few phrases that were quite interesting here over lunch. Try to bring it back to our Texas friends, but it's really an honor to be with you and to have a conversation. I thought we'd take just a few minutes and let people know who you are, learn a little bit about the program, and really how people can help. Is that fair?
Yeah, sounds great.
So tell me a little bit, how did you, tell me a little about your background.
Well, I studied medicine here in South Africa, and shortly thereafter I was given an opportunity to work for Hope Worldwide in West Africa, and actually in Cote d'Ivoire, where we have an HIV/AIDS clinic taking care of indigent patients who cannot afford healthcare. And so, newly married, Kerry and I headed up there, and spent 10 years there actually, working with the center and really dealing with a lot of issues related to HIV/AIDS. We had a lot of patients who couldn't afford even the most basic of medicines, and in those days we didn't have the kind of therapies that we have today for HIV and AIDS. And so ran that clinic for 10 years, and but also noted that there were a lot of community issues related to HIV. As people were getting sick and dying, there was a lot of orphans and vulnerable children in the community that needed help and support, and they weren't getting any. So we started community programs looking at how best to take care of these children.
As part of the clinic?
As part of the clinic, as part of our outreach to the community. We also had extensive prevention campaigns. So what we wanted to do is stop people getting infected, but if they were, we had the center that could provide the care and support.
What year was this? Just ballpark?
This was from 2003 to 2013.
Oh, okay.
Yeah.
Great.
Yeah.
So tell us a little bit about how you went, how you got into the early childhood development programming.
Right. Well, I think the evidence shows that the first few years of life are just so critical to a child's development. And yet, millions of children today, not only here in South Africa, but across Africa, are not reaching their full potential because they're just not getting the right nutrition, the right nurturing or stimulation to be able to help that brain develop. So we have a massive problem on our hands. And we know that what happens in early childhood will last a lifetime. So when we saw this problem, we did our own research around, what we do in terms of finding solutions. And we realized, number one, that there were preschools in these communities that we were working in, but these preschools were not equipped or capacitated to really provide quality service to children. Teachers weren't trained, the infrastructure was poor, the nutrition was poor as well. And so we've come alongside a lot of these centers, equipping them, refurbishing them, training the teachers, and helping them provide quality nutrition to many of these children. And we're seeing the impact of that.
So there's well-intended centers already in place, and you basically come alongside and actually mentor them and support them and provide tools and services to raise the quality of their care.
That's exactly right. And our goal is to get them to a point where they can get registered with government as a bona fide center, a preschool, and then government will provide funding through a subsidy to help them continue and be sustainable. So that's kind of our goal.
That's incredible. How many of these centers have you actually helped to date?
Well, well over 100 right now, and
in South Africa.
In South Africa, that's correct.
Has this gone beyond South Africa?
We're hoping to replicate this model across Africa, where we have programs, and we are already seeing programs starting in Zambia, Botswana, Mozambique. We want to replicate this model as far as possible, literally across Africa in terms of the center. We started basically with sort of a community needs analysis. We looked at what was in place, what wasn't. Realized that a lot of the preschools that were running just had very poor infrastructure, teachers weren't trained, the quality of nutrition that they were offering children was very poor. Realized there was a massive need there already. But we also realized that many of the children in the community weren't even able to access these centers, these preschools. They were at home. Mom had to go to work, and so mom was leaving their child with a neighbor, a caregiver, and they were getting almost nothing in terms of nutrition and stimulation. So what we did was we started a program firstly to support these centers, building their capacity, helping them with their infrastructure, the classrooms, the bathrooms, getting those fixed up. Then we've been supporting teachers with training. Our training is aligned with the government's national qualification standards. And then we've been able to provide these centers with good, healthy nutrition and training around good nutrition. So it's been exciting to see how these centers have been able to go from subsistence to sustainability as we build their capacity. Many of them are getting registered with the government and even subsidized so that we can move on and help other centers.
So success is breeding success.
Absolutely. Right? So we are reaching over 10,000 children every month, providing them with support, nutrition. We reaching over 100 centers. We have a staff of 80 across the country, many more on the continent.
So that's less than 1 per center.
Right.
So that's good.
And our goal in the next couple of years, by 2020, we want to double the number of centers, triple the number of parents that we're reaching just here in South Africa. And we believe that we can take this model and replicate it across the continent of Africa.
So this early childhood development, you identified sort of a key opportunity. Why there?
Research shows that this window of opportunity provides the greatest return on investment for a child. What happens in early childhood will last a lifetime. And so we're not in the business of charitable work, we're actually in the business of development, helping these children develop into productive adults one day.
So you developed a solution. Give us a few bullet points on what you've developed.
So what we've done is we've realized that in order to maximize on this return, this window of opportunity, we've targeted preschools in disadvantaged communities across 6 provinces here in South Africa, and we're providing them with the capacity, the training, the infrastructure to make sure that they can deliver quality services and support to children.
So you have training manuals, I'm presuming you have
That's right.
best practices,
Yeah.
and you measure metrics around those and establish some data-driven progress?
That's right. So in terms of the centers, we have an assessment tool that looks at their needs, areas of growth, and we work with them to ensure that they meet the government standards in order to provide those quality services. In terms of the parenting program, we have a curriculum. It's a 5-month curriculum that takes a parent through 10 different modules, helps build their own self-confidence, promotes positive parenting, and also helps them understand their own child's development. And we've seen remarkable results using this curriculum. We've seen dramatic change in children who had developmental delays who are now actually reaching their milestones. So it's really exciting to see.
So how many years have you been working on developing this program?
It's taken us about 5 years to get this program right, and we believe this is now, we're in a position to replicate this model, and we're seeing donors, we're seeing government actually buying into this and looking at it as a replicable model that we can take not only here in South Africa, but all over Africa.
So tell us a little bit about a unit center. What are the dynamics of a single center?
I think we've estimated that it takes about $10,000 to take a preschool from where we found it, all the way through training, infrastructure development, and mentoring to a point where it can get registered with the local government department and get subsidized. More or less about 12 months. And that allows it then to become sustainable. It attracts more children, it attracts funding from other sources as well. So that's more or less what it costs.
That's great. So you're basically investing in these centers to improve the maturity model, their maturity as a center.
Right.
And then that makes them essentially, they have the opportunity to be sustainably performing at that higher level.
That's correct.
So it's a one-time investment essentially for a year, and then you have these children. How many children per center are you talking about the average treatment or average support?
So we're looking at anything in the range from 50 to 100 children, depending on the location and so on.
That's incredible. So
Yeah.
imagine the investment over their lifetime.
Right, right.
Terrific.
So for $10,000, you're going to transform the lives of those 50 to 100 children forever. That's how we see it.
Yeah, that's impressive. So to scale this thing, let's talk a little bit about the capital requirements and how partners can help and what you need.
Well, we want to replicate this to over 200 centers by 2020. So doing the math, 10,000 times 200, we're looking at about, okay, we'll stop there. I don't know what the math is.
Yeah.
$10,000 times 200, 20 million?
20 million. Yeah.
Okay. You want to just answer that question again?
Okay.
So let's talk a little bit about scaling and the opportunity that you see in front of you.
We want to take this program, the center-based model, to another 200 centers here in South Africa. And we believe it costs about $10,000. So by 2020, if we can reach another 200 centers, we estimate that that'll cost us about $20 million to make sure that these centers are sustainable.
So Marc, talk to me about how you funded the project to date.
Well, I believe our effectiveness has been validated by the quality of our partners and our donors. And we're so excited that we have partners like Walmart, who own a large retail chain here in South Africa. And we are their national corporate social responsibility partner for early childhood development.
That's impressive.
We also have partners such as the US government, who's also invested in our parenting program. They love what we're doing. They believe in the work we're doing, and they're seeing the impact too. And more recently, the South African government is now getting involved and see ECD, early child development, as a priority, and they want to partner with us to continue to make the impact that we're having.
So these are corporations and government organizations that really care about having an impact, and in their CSR groups are supporting what you're doing.
That's correct.
That's great. Okay, well listen, Marc, it's been terrific. Thanks for taking a few minutes with us. And we look forward to going to Mozambique and spending some time with some of the centers, and we'll have some shots there to tell you, kind of show you firsthand what's really happening here. And really, I love the passion and the leadership that you've shown. You know, especially crossing beyond, not just being an effective sort of, human rights organization or sort of a humanitarian organization, but also crossing over to speak the language of corporations. I appreciate it. Thank you.
Thank you very much.
Okay.
Thank you.